the Jim Bakker Show, coming to you from the village of Morningside, snuggled in the beautiful Ozark Mountains. Today, Jim's special guest, Dr. Bruce Fife. I'm Kevin Shorey, and that's the Morningside Band. And now, direct from Gray Street at Morningside, here are your hosts, Jim and Lori Bakker.
Hello, everybody. Welcome to Gray Street. I think I've read every one of his books. I think you've written about 20 books. Is that right?
That's about right.
Fife, please welcome.
Nice to have you. What
Thank
an
you.
honor and a blessing.
Dr. Bruce Fife. And one of his most important books he has written, I believe, Doctor, is Stop Alzheimer's Now.
Wow. You know, Dr. Fife, I believe for my generation, the baby boomer generation, I really believe that it's I know we're all, I hate to use the word afraid of it, but if there was any fear I had, physical fear for my own body, it's getting Alzheimer's. And I keep hearing it over and over by so many in my generation that they're watching their parents with it right now, and they're so afraid that it's going to happen to them. And so just to know that there's some answers.
Just a few days ago, there was an article, what news?
Yes. It was from Reuters.
Reuters, yes.
And it says this: Alzheimer's deaths much more common than realized. It says nearly 500,000 elderly Americans likely died from Alzheimer's disease in 2010. Now that's a complete shock, because the Center for Disease Control said that annually about 83,000 deaths are occurring from these types of Alzheimer's, or just all types of dementia.
What causes this difference then?
Well, this is what happens. One of the reasons it is so hard to estimate the number of deaths from Alzheimer's is that dementia can be the underlying reason for a number of more important causes of, or more immediate causes of death. For instance, severe dementia can lead to problems swallowing, which leads to malnutrition, which can lead to pneumonia, the study authors write. So, death certificates tend to list the immediate cause of death in the case of pneumonia and leave out dementia. So they're actually recording that many people are dying from other different types of sicknesses rather than dementia itself. Because like I said, the Centers for Disease Control said 83,000 a year, but this article is actually saying nearly 500,000 people a year are dying from dementia.
Unbelievable.
Now, you said your book title is Stop Alzheimer's Now. We're not going to get deep in it right now because we got a couple things we need to do. But you told me last night when you arrived here, you said we have a plan. In fact, part of your book, it's the Alzheimer's plan of attack or something like that. Is that right?
That's correct.
And so you really believe there's hope for Alzheimer's. There's hope to prevent it, and hope even to restore people that are in bad shape.
That's exactly right, and it's been proven, because people who do go on to this plan, they stop the disease, they can reverse the disease, and in some cases they can completely eliminate the disease.
Yeah! How many here sometimes worry about Alzheimer's because you forget your keys?
Yes.
Come on, raise your hand if you sometimes think.
Who hasn't? Now, if you haven't, then you're just supernatural, I guess. But I mean, who doesn't think of that?
I can't say favorite cousin because I have so many of them.
Yeah.
But my favorite cousin, I'm going to say it anyhow.
Yes.
Taught school her whole life, the most brilliant mind in America. I think she taught till she was 80.
She did.
80 years old, and she is the most wonderful human being on earth. I just sent her a birthday card and said she's the gift to the world. She really was.
Yeah.
But she has Alzheimer's.
Yeah.
That can't
A
be.
brilliant mind. Yes.
The most brilliant mind in the world. I don't know about you, but I get angry when I lose people that are brilliant. Yeah. Like President Reagan, who I got to sit with him. I got to be in his home. I got to walk and talk with the man. And he died this horrible, long death called Alzheimer's. And Dr. Fife, and I'm so glad your beautiful wife and you said you'd come. And when I don't welcome everybody at the front door, but I was there to welcome you because I couldn't wait for you to get in. I just couldn't wait for you to be here. Can I shake your hand one more time? Welcome.
Thank you.
You give hope. I love hope. Now, I know there's people in government and people in high places that don't want us to give any hope out. They really don't. But you even believe that what you've been studying is a war against cancer as well, in what I've reading. Is that right?
Well, actually, if you follow this program for Alzheimer's, it also is an anti-cancer program as well. And so it will work with cancer or Alzheimer's. And in fact, it works with any type of brain neurological problem. So Parkinson's disease, ALS, Huntington's disease, stroke, things like that.
Oh, that's stroke.
Dr. Bruce Fife is here with us, and he's written so much about coconut, and people are skeptics. But I'm telling you, the reason I bought the David Perlmutter's book, because he's well known, and if you've seen him on public broadcasting, he did a few, maybe 6 months ago, he did the fundraiser where they teach, and he taught this whole subject, and very seldom do I buy the whole thing. I bought, they call it the enchilada on that show. You know, I bought the whole enchilada. Enchilada, whatever it is. I bought the whole thing. I mean, the videos, the audios, everything. And this man is so high, can you get high on coconut? And so that's where I started reading about it. Then I read other books, and then Dr. Bruce Fife. If you go online, you will find more books by this man on coconut than any other person in history.
Wow.
How does it feel to be the top most authority on coconut?
Kind of weird.
Do you get a lot of jokes? Do you make jokes about it a little bit? Because
Well, I do.
coconut sounds funny. Like,
It is, and when we started traveling around the world, we'd go like to the Philippines, people started calling me Dr. Coconut, and the name kind of stuck. And so I'm known as Dr. Coconut. That's fine.
That's good. That's a good thing.
you know, what's crazy is that you can laugh about a coconut, but what I've discovered, it's probably the greatest product we have that God has given us in the raw form on earth. Do you think that?
It is a superfood, and it has so many health benefits. I don't know of another food or fruit or produce that has as many health benefits associated with it.
One of my favorite doctors, he is a man Dr. Williams, he goes to mission fields. He goes to where there's an earthquake or a tornado or a tsunami. He goes there to help people. And he said he's actually used coconut, the water inside of the coconut, and put it intravenously when they didn't have blood plasma. Have you ever heard of that?
Yes, it started back even before World War II, where researchers actually experimented with using coconut water for this because the makeup of the water, the electrolytes, the sugars, the proteins and stuff were very similar to what we already have in our blood. And so they tested it out there. And then during World War II, there were many times available when they didn't have commercial IV solutions. And so the doctors would just take a fresh coconut, they'd poke a hole where the eyes are, and they put a syringe in there. There was a hose with another syringe, and they'd stick it directly into the vein of the patient, and they would get their water, their nourishment from that.
Oh my goodness.
Your wife has a book, and she's going to be on a show coming up. And I could just show her book a minute. Cooking with coconut flour.
Well, I'm excited to have this book.
And,
Boy.
And so what I want to do is, just for fun, do you have the cake ready?
This is Cooking with Coconut Flour, which is Dr. Fife's book.
Low carb.
And it's low carb.
Gluten-free.
Gluten-free.
But we're going too crazy, which I'm just trying to give an overview of everything is what I'm trying to do. Oh my. When I found out reading your books, Dr. Fife, that I needed some oil in my system, and I realized I was having trouble thinking, having trouble remembering things, and it was getting worse and worse. And it was to the point I thought I didn't know how many more days I had on the air.
Right.
And so privately, I have been taking, and I do everything your book says.
It's true.
I do this book, oil pulling therapy.
Now, anybody
How many ever
heard of it?
oil pulling?
1, 2,
1, 2,
3.
3, 4, 5. Must be some friends of yours here in the audience.
Well, we do this every single day.
Let's
So
roll
we-
that little piece with Kathy Lee and Hoda.
What's your favorite thing? You guys are going to die. This is so genius.
This is so weird.
This is coconut oil. Okay, you've not this brand, any brand you want. This is coconut oil. Somebody told me there's something called swishing and pulling, where you take a spoonful of coconut oil, put it in your mouth, swish it around. It kills bacteria. They said it kills plaque. It helps with breath, and somebody said it even helps whiten your teeth. You should consult with a dentist, but I didn't. So you take a spoonful. Would you do it too? Take a little spoon.
No, I have chicken in my
Spit it
mouth.
out. Put it in. It melts. Look,
Excuse me.
it's oil. Don't swallow it because it's gross if you swallow it.
What's the first thing? Well, it says to do it for 20 minutes. Oh, no, thank you.
Whoosh it.
Oh!
It melts.
Oh, I don't think I'd like that, Huda. I don't think I'd like that. Are you going to spit it out? I apologize right now for her.
Okay, I'm not kidding, you guys. Your breath is it totally makes your breath smell great. Anyway, try it.
Yeah.
Well, what she was talking
Well,
about was the pulling.
I was just checking
and
in that
it was.
it does it actually gives you good breath as well. But it takes. So I was trying to tell you about it quickly. Like yesterday, I was down and working at the old mill. The infection, all that dust, I was getting just like I'm coming down with the flu. What is that? What is that? Is that from the
From the dust.
allergies in the
Yeah.
dust? And usually then it'll get in my head, then it'll go into my lungs, and then I get pneumonia. So what I did, I went home immediately. You know, at the end of the day, I went and I did the pulling. Usually I do the pulling in the morning when I get up, because I leave it in there for, it's up to 15 minutes,
So you just take a teaspoon or a tablespoon. I don't know what's best. A teaspoon. What would be better?
I wouldn't take that much because that's kind of a lot. And the reason
Well,
for
I
that,
couldn't take that much, so I'm glad you're telling me. Good. Okay.
because when you put it in your mouth and you start swishing it, you're
Yes.
going to have saliva come and fill your mouth up too. So you don't
Totally.
want too much.
Yes. So
I thought the more the better. But the thing it does, it pulls infection out. Tell us what this book, Oil Pulling, is about. Get a highlight of this book.
Well, that's why it's called oil pulling, because it pulls bacteria, viruses, fungus, plaque, pus, mucus. It pulls all these toxins out of your mouth, and then you spit it out and you get rid of it. And it's leaving your mouth much cleaner and much healthier. And as a response to that, you get whiter teeth, you get firmer, healthier gums. It gets rid of bad breath, even deep-seated infections, abscessed teeth and stuff. The poison, the pus, the bacteria is pulled out, and so your mouth is much healthier, much prettier, better overall health.
I find out when I start doing it, at times when my sinuses are, all of a sudden I'm doing this pulling, and my sinuses are draining down and going, it's coming down the bottom of my throat, and I got this stuff in there, and but so I spit it in a cup or a garbage can, because you don't want to put it in your drains. You don't want all that oil going in there probably. But it is the most amazing thing. And today, what we're going to do, just to get it started, tomorrow we're going to really get deep into this. But we put together an offer that is going to be amazing. And the biggest thing, this big book right here is called Stop Alzheimer's Now. And the key thing, and the books that I'm reading, the doctors, the MDs that are going to this, they are telling the patients, basically, there's not a whole lot of answers for Alzheimer's, but they're saying one thing. I read a book about an MD, a lady MD, and her husband had Alzheimer's. Do you know them by any chance?
Yes, I do.
Do you? I thought you knew everybody. Tell us that story, and tell us what's going on in the world.
That's really an amazing story. In fact, she contacted me when she was doing this to tell me the progress that her husband was experiencing. He started developing Alzheimer's at the age of 53, so he had early onset Alzheimer's. And when she contacted me, he had had it for 5 years, and she had put him on all of the drugs. Since she was a doctor, she, started off early, but, the drugs didn't do any good. And actually, the drugs don't work that well. And so she was getting desperate now because he was getting worse and worse. And so she started looking for experimental drugs that were coming down. She wanted to sign him up to be a participant in one of these experimental studies. And as she was researching all these drugs, she found one that showed particular promise because in preliminary studies, it showed that the drug actually had Alzheimer's patients improve. There has never been a drug that actually showed improvement with Alzheimer's. So this is the first time she'd ever seen a drug with that potential. So she wanted to sign him up. So they went down to sign him up. And before he could actually enroll, he had to take a test called the MMSE, Mini Mental State Exam, which determined what level of dementia he had. Well, he took the test and he scored way low. He was scored so poorly, they rejected him from the study. He was considered hopeless. Well, his wife had done a lot of homework, and she had actually come across the patent application for this drug. Yes. And this drug contained preliminary studies. It contained the theory behind it and why it worked. It also contained the formula, believe it or not. And so she found out that the drug contained only one active ingredient, and that ingredient was fats derived from coconut oil. Well, since she couldn't have her husband participate in the study, she thought, well, we can just buy coconut oil. So she went to the local health food store, bought a jar of virgin coconut oil, brought it home, calculated how much coconut oil she would need to give him to match the amount they were using in the study. So it came out to 2.5 tablespoons, and she started giving that to him, and the results were phenomenal. That day, they went to an appointment with their doctor. He retook the test, and he scored much higher. That never happens. Alzheimer's patients never get better. But with one dose, he scored significantly higher on the test than he had before. He was almost into the mild range, when before he was near the severe range on the test. So they knew that they had discovered something. So they continued him on this oil. And over the next year, he regained the ability to read and to type on a computer keyboard. He would get on the computer keyboard and surf the internet. He regained the ability to dress himself properly because he wasn't doing that before. He improved so much that he started volunteering his services at the hospital where his wife worked, working in the shipping and receiving department. He retook the MMSE test, and he scored in the mild range. So he went in 1 year from in the severe range to the mild range just with coconut oil.
All from coconut,
and
from this.
And why people, won't try it, things that are healthy. I mean, medical doctors are recommending this. I'm studying Alzheimer's. This is the only thing at this moment I found that will do anything. I know there's got to be some medicine, but one of the this doctor, I believe this doctor right here, he said in his book, the reason we're not finding the cure through coconut is there's no way to patent it.
That's exactly right.
And that's another way of saying there's no money in it.
Mm-hmm. Yep.
But I'm just saying, eat right anyway. Let your food be your medicine, and let your medicine be your food is still a good... Right now, stop Alzheimer's now, the oil pulling therapy, the coconut cures, preventing and treating common health problems with coconut, and you ain't heard nothing yet. If you got it, this will probably help fix it. But anyhow.
Well, let me just say one quick thing about the coconut cures. I'm just reading the back of this book for the first time, honestly. Prevent heart disease, dissolve kidney stones, balance blood sugar and control diabetes, enhance the immune system, protect against cancer, boost your energy and increase your metabolism. Hey ladies, what about that? Lose excess body fat, kill disease causing bacteria, viruses, and fungi. It goes on and on.
And read what he says. These oils don't make you fat. You don't even believe fat makes you fat.
That's correct.
What makes you fat?
Dieting. Low-fat diets will make you fat.
How many of us have lost a bunch of weight and then gained it all back again
But
from
your
bad
brain,
dieting? And, oh, yes.
I got to say this. How much of your brain is fat, made up of fat?
60%.
60%. I've been saying that, haven't I?
Yes.
And here's the doctor. 60% of your brain is fat. And what's happening, Alzheimer's patients, when they do autopsies on them, the brain is shrunk, this front part of the brain, right?
That's correct.
Boy, see, I'm a good student.
You are.
And you're going to give me an A, I hope.
Yes.
No, but here's what we've been doing. We actually need cholesterol because the body makes cholesterol, doesn't it?
It does, and the brain even makes cholesterol. Your liver makes cholesterol, but your brain even makes cholesterol because it's so essential for good brain health.
And they're finding out that cholesterol medication
Can lead to Alzheimer, dementia, as well as diabetes.
No
Yes.
way.
You need to read up on it, people. We've got an epidemic, okay? What's wrong with praying and asking God to give us wisdom to find some things that'll come against this epidemic called Alzheimer's and dementia and all these other things? There's hope. There's hope. I'll tell you what, too many people are getting this horrible thing called Alzheimer's, and that's why I've declared a war on it. I'm not a doctor. That's why I hang out with a lot of doctors of all different persuasions, and I'm telling you, together, I am learning that if there's one thing, doctor, it's coconut oil, coconut powder, and we haven't begun to even show it. So people want to be healthy. People want to do these things, and together, you know I test everything.
Everything.
You know I have a jar of this sitting right in my bathroom.
So do I.
I test it.
We keep the coconut oil, each one of us, by our sinks in our bathrooms and also in the kitchen, right where we can see it. So we use it to cook with. We eat it literally just
you
like this.
fried foods? Don't eat the bad fat. What's the bad fat?
The bad fats are the polyunsaturated vegetable oils, the corn oil, the soybean oil, the safflower oil, those types.
So don't eat the bad fats. But here's the thing. We cook like our kale, the green kale.
Kale chips.
We fry and put a bunch of this in a pan, and it gets crispy and greasy. It makes you feel like you're eating something really wicked. But the more of that oil you get into you, it's feeding your brain.
Yep.
It's the good oil.
Yep.
It's the God oil, I believe.
In fact, I used to cut out all fried foods from my diet totally for several years until I learned about coconut oil and that it's so good. Now I've introduced fried foods back into my diet because I know I'm doing myself good.
And you fry it right?
Yeah.
And fish and all those good things. Well, we have to go for today, and we're sure glad you were here, and I can't wait till our next show.
Thank you.
Dr. Fife.